Hi, everyone. We're running into a little bit of technical difficulty, but we should be up and running in just a few minutes. Hi, everyone. We are making progress, but we need a few more minutes. Thank you.
Okay, good morning, everyone. Welcome to the April 2025 Executive Committee meeting. It is now
10:27.
10:27, and I'd like to call the meeting to order. Ebony, will you please take roll?
Yes, ma'am. Miss Angela Harmon. Present. Miss Christy Gonzalez. Miss Brooke Stewart.
Present.
Miss Renata Washington. And Miss Jill Ham.
Here.
You have 3 and you have a quorum.
Okay, perfect. All right, at this time, Ms. Harmon, can you please read the virtual protocols?
Yes, ma'am. Thanks, Jill. Before we get started, I just want to remind you all of a few rules. For committee members, and members of the public attending in person, please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, remember you must be on camera and have your first and last name showing to be counted toward our quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand to request to speak and wait to be called on by the chair. For attendees, electronically raise your hand to request to speak. Once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A is only to be used by those needing an ADA accommodation to participate in the meeting. Public comments will not be accepted via the Q&A except for those individuals who requested accommodations. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will then be called on, followed by public participating virtually who have their hands raised. Comments in the Q&A and chat will be addressed last. As with all hybrid meetings, it can be difficult to keep track of all those wanting to speak in person and virtually. Please be patient. All comments and questions from committee members and the public may be limited to 3 minutes or less should we run into time constraints. So please keep that in mind. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during designated public comment periods. The chair may also use their discretion to determine if comments will be accepted outside of those times. Thank you.
Thank you. Okay, okay, sorry, thank you. At this time, Ms. Stewart, will you please read the mission statement in the ground rule?
Yes, I'll start by reading the mission statement. To increase independence, self-determination, productivity, integration, and inclusion for Louisianians with developmental disabilities by engaging in advocacy, capacity building, and systems change. Okay. I will now begin the ground rules. Members must be recognized by the chair before speaking, be respectful of each other's opinions, break for 10 minutes every 1.5 hours, discuss council business in a responsible manner, except as necessary, restrict the use of electronic communication, for example, texting during council and committee meetings, silence or turn off all cell phones. Mission statement is posted at every meeting, be on time for meetings, no alphabets, and no side conversations are kept to a minimum, done quietly and restricted to the subject at hand.
Okay, thank you, y'all. Okay, the next item of business is the approval of the meeting summary, a draft of the January 30th meeting summary has been distributed. There or the summary will not be read unless requested by a member. Are there any corrections? Okay, if there's no objection, the meeting summary is approved, it's distributed. Hearing none, the meeting summary is confused. Is approved. Everything is that ain't right.
Yes, so it's approved by unanimous consent, since no one had any objections. So you can go to the next item. Okay. So look in the agenda, you can go.
Okay, so moving on to our agenda. Sorry, the first item of business for this executive committee is the update on federal issues. So it says 504 lawsuit, ACL intention of funding and Medicaid, some of which is in your package, So Ebony, I give you the floor.
Okay, so we have a lot of updates at the federal level. And so I'm gonna go through each one and then I'll pause, and if anybody has any questions or comments, I'll let the chair take those at the time. So I'll start with the Section 504 lawsuit. Here is what we know. The Section 504 lawsuit is a court case in Texas that was filed in September 2024. A group of 17 states, including Louisiana, sued the United States government, and they were asking for the court to get rid of Section 504 and the updated rules that they came out with in 2024 that protect people with disabilities from discrimination in healthcare and human services. Now, I'm just gonna provide a little background because I know we have some new members here. What is Section 504? Section 504 is a law that says that anyone who gets money from the United States government to serve the public or do business cannot discriminate against people with disabilities. So the rules in Section 504, just some examples, say that schools must include students with disabilities and help them learn. Doctors in schools must have sign language interpreters for people who are deaf and hard of hearing who sign, and videos must have captions. Doctors must have clear information to disabled people. This includes people with intellectual and developmental disabilities. Websites for schools and hospitals must work for people who are blind and low vision. Doctors and hospitals cannot stop helping someone because they have a disability. And doctors and hospitals must have tools and machines that work for wheelchair users. This includes machines that check for cancer. So those are a few examples of what Section 504 has, some of the rules that it has in it. And over the years, the rules have been updated. And like I said, the latest updates came last year in 2024. And so originally, the states that filed this lawsuit, they were stating that Section 504 was unconstitutional. And they were asking the courts not only to get rid of the updated rules that came out in 2024, but they were asking the courts to get rid of the entire thing. So in response, we did send some action alerts. I hope everybody responded to our action alerts. We sent action alert number 4, and that was for advocates to reach out to our Attorney General here in Louisiana, Ms. Liz Murrill. And then we sent an updated action alert on February 28th because the AGs that filed they filed a joint status report, which suggested that the AGs were only looking for 504 protections within the programs funded under the Rehabilitation Act, like the vocational services. But this would mean things like housing, education, and healthcare would no longer be bound by Section 504 protections. So again, in that updated alert, we asked our advocates to reach out again to our Attorney General's office. Now, the latest update that we received on April 11th was that the 17 states filed another joint status report stating that they're no longer challenging that Section 504 is unconstitutional. They dropped that part of the lawsuit. But they are still challenging the updated rules that came out in 2024. So those rules include things like prohibiting or not allowing discrimination in medical treatment, which disallows discrimination in administration, criteria, or protocols related to medical care of individuals with disabilities, including how those resources are distributed. And so we saw that a lot during the pandemic. We saw how healthcare systems were discriminating against people with disabilities, which is why they wanted to come out with the rules. So now they dropped the unconstitutional part. They're not saying the entire thing is unconstitutional, but they are still saying that they don't support the updated rules that were released in 2024. So we're still actively advocating. We're still telling our advocates, LaCan advocates, and council members to reach out to our Attorney General's office to make sure that, you know, she knows the importance of those updated rules, that they affect our community, our disability community. So that's sort of the updates that I had for the Section 504 lawsuit. I encourage everyone to continue to reach out to Liz Murrow's office, and just, like I said, continue to make sure that she knows that those protections that are in the updated rules in Section 504 are just as important as the entire. So does anybody have any comments or questions? Does the committee have any comments or questions? I'll try to answer them if I can.
I have one question. But I don't want to sound ignorant.
We'll go, I mean, you can ask your questions.
So is this lawsuit? Cause I just browsed through the lawsuit. But then what you're saying doesn't seem to align with these papers. Like, it's this about one certain, like, disability.
No.
Cause, okay, and I don't wanna say anything. Okay.
So that's the original lawsuit, Jill. That's the original lawsuit that you had.
So there's more in this than the gender dysphoria.
Yes,
Okay, cool.
yes.
All right.
And so for anybody that needs like background for what Jill just brought up, the language about gender dysphoria in the preamble of the updated Section 504 rule, there's a section in there about gender dysphoria. Now, the previous administration considered gender dysphoria a disability. The current administration does not consider gender dysphoria a disability, and therefore it will not be protected under the federal law. So the language in the preamble of Section 504, that's where the just gender dysphoria is located, or that language is located. They're basically saying it does not have the force or the effect of the law. So they don't recognize it as a disability, so, gender dysphoria will not be protected under section 504. Now, individuals with disabilities that identify as gender dysphoria, they still will have those protections, but having gender dysphoria in general will not.
Okay,
Does that answer the question or kind of clear up things?
yes,
Okay.
okay, so what Angela, any question?
No question.
Okay, public. All right, Ebony, can you please continue?
Yes, ma'am. Okay, so the next item is the restructuring of the administration for community living. And this is what we know. March 27th, the U.S. Department of Health and Human Services, HHS, released a statement and they announced the restructuring of the Health and Human Services Department, including the reorganization of ACL, which is the Administration for Community Living. The state PD councils, the protection and advocacy agencies, and the university centers of excellence on developmental disabilities are all housed under the Administration for Community Living. So, of course, that statement brought concern to all of our sister agencies and the DD councils across the country. Basically in that statement, they also informed everyone that HHS plans to integrate its programs into other offices within HHS, including the Administration for Children and Families, the Assistant Secretary for Planning and Evaluation, and the Centers for Medicare and Medicaid Services, or CMS. April 1st, HHS started eliminating a significant number of employees across its programs. But as of today, ACL staff, including the leadership for the Office of Intellectual and Developmental Disabilities, and our program officer that actually reviews our annual state plans and our program performance reports, those employees are still employed. That's as of today. That could change at any point. And I'm gonna ask whoever is sharing items. I added 2 items to the website. If you look under other handouts, there is ACL organizational chart. And there is a text version for anyone that needs that accessibility option. There is a text version on the website as well. So I kind of just want to share with you guys what the reorganization looks like, and what offices they have eliminated. Okay. Yeah, that's fine. Okay. Oh, go ahead.
Oh, sorry, it's like delaying a lot.
Okay, so I'm gonna go ahead and start while Amanda's kind of playing with the Zoom thing. All of the boxes at the top that are in gray, all of those offices were eliminated. So this is all of ACL. Where we are is, if you look on the right-hand side of the chart, there's the Administration on Disabilities. That is where we fall. We're actually right under the Administration of Disabilities, the Office of Intellectual and Developmental Disability Programs. That is where the state DD councils are housed. And so as of right now, we're still around. But as I go into the other updates, you guys will see where we have cause for concern with the budget that was leaked. So I just kind of wanted to share that with you guys, that there has been a lot of restructuring with the Administration for Community Living, and that is very concerning because the Administration for Community Living was created in 2012 to make sure that they deliver real results for people with disabilities. It was created for the aging population and individuals with developmental disabilities to specifically carry out those programs. And so the departments that they are considering reorganizing ACL under, they don't have the same priorities and they may not have the same resources as ACL. So that restructuring is very concerning. So I kind of want to jump right into the budget, which is related to the restructuring of ACL. So here's what I know. The councils were informed on April 16th that a draft budget proposal from the Office of Management and Budget, OMB, for fiscal year 2026, which begins on October 1st, 2025, was leaked. So this is basically the president's budget that was leaked. And it was put out on several news stations, social media outlets. And basically the document that was released proposed reorganizing and ending many disability and aging programs. That includes the state councils on developmental disabilities, the Louisiana State DD Council, as well as all the DD councils across the country. Also the protection and advocacy agencies here in Louisiana, that's Disability Rights Louisiana. In other states, it's Disability Rights Tennessee or Texas, Disability Rights Florida. So those our sister agencies as well have been pretty much eliminated in this proposed budget, as well as our University Centers for Excellence. Here in Louisiana, that's LSU Human Development Center. And it's different universities across the country. So all of our services were zeroed out. And if you zero out a program, that basically means that you're eliminating. Now, that was a proposal. And so like I said, I'm gonna tell you guys what I know. The president's budget does not determine program funding. Congress will decide what federal programs they're gonna fund and what federal programs they're not gonna fund in their final budget for FY 2026. It's just like our state budget. The governor gives a budget, but our state legislature is responsible for making, for funding what they feel needs to be funded and what they feel doesn't need to be funded. So again, the federal fiscal year 26, it begins on October 1st, 2025. And more than likely, I'm saying this because this has been the pattern for the last few years, especially since I've been here. More than likely, Congress will not have agreed on a budget by October. And typically when that happens, they sign a continuing resolution. And so we've been in continuing resolutions at least for the past 2 years. I know for FY 25, we received the continuing resolution March 14th. So they signed a continuing resolution funding us at level funding for the rest of 2025, which ends September 30th, 2025. I know these dates are kind of confusing. But we are level funded for the rest of 25. Now for FY 26, we're gonna have to watch the budget as it goes through Congress, as it goes through the House, as it goes through the Senate, and make sure that we advocate and make sure that our congressional delegation, the Louisiana congressional delegation, knows how important the councils are, the protection and advocacy agencies are, as well as the USAIDs. We want to make sure that they know all of the DD Act programs are important and they need to continue. So our NACDD board, which is our National Association for Councils on Developmental Disabilities, our board and their staff are offering all of the councils guidance, communication campaigns, tools, just to help us to move as a cohesive network. So I know that NACDD has been in contact with the national organizations for with our sister agencies for the protection and advocacy agencies as well as the USAIDs, and they are actively coming up with campaigns to make, not only to advocate for ACL, but also for the state DD councils for the USEDS and the P&As. So, this is what I don't know. We don't have a timeline for the reorganization, so I don't have a timeline for when the rest of ACL will be moved, or where they will be moved, where, they'll be housed. And then I don't know if Congress is going to, what they're going to do with our funding. So they could reduce our funding, they could leave it level, they could reduce it, or they could eliminate it. And so, of course, we as advocates, we're gonna do what we do best, and we're gonna advocate. I think one of the greatest things that the Louisiana DD Council does, is different from every other state, is advocacy. Lacan has done some amazing things, and I just think that that can carry over into, our federal issues that we're facing right now. So that's all I wanted to say about the restructuring of ACL. Does anybody have any questions? Jill?
Oh,
Aiden has one.
I'm sorry, can you repeat your first name?
Aiden,
Anything you have the floor?
thank you. I was just wondering who's getting the funds? Who's getting the funds?
Okay,
I know that's like a not very full question, and I apologize for that.
well, no, you're good. Yeah, that's a good question. So, the legal budget had a, line item for like $453 million for the independent living program. So federal funding is level funded for the Centers for Independent Living, and an increase, they had an increase of around 325 million. So on page 48 of that leaked document, it basically states that that increase in that money will go to state grants, and those grants are intended to provide flexibility to states to use, that funding to provide services and supports for those disability programs that were eliminated. So not all of, it wasn't like an equal, all the DD Council funding, all the P&A funding, all the USED funding is in that 325 million. It doesn't add up. So they are getting, in the proposed budget, and I just want to keep reminding everybody, it's just a proposal. They had $325 million going to the Centers for Independent.
Thank you.
Sorry, okay, so thank you, Ebony. So to continue this topic, which is an interesting topic. Do you have something on Medicaid to talk about?
Yeah, before I go to Medicaid, I just want to explain the document that's in y'all's folder. So I included, the current and projected council activity funding, because if there is a reduction in funding, we are currently working on contingency plans as a staff. We're working on our annual, gotta go back, I'm sorry. Our annual.
You're trying to get at it.
Oh, God, our annual report for 2024, and we're working on impact statements. NACDD has asked us for all of those things. And then once we get those things out, we can use those in our advocacy to show the impact, specifically for the Louisiana DD Council, specifically our annual report and that'll highlight all the initiatives that the council did on last year. So, we're also collecting stories. So we sent out an LADC news on Monday, and we shared it on our social media. So I'm encouraging all of our council members for sure, to make sure you go in and share your story about the impact that the DD Council has had. So that we can share those stories with our national organization, NACDD, so they can share those stories on Capitol Hill with not only the Louisiana delegation, but all the senators and representatives that are representing all the states. So, I just wanted to make sure that I pointed that out. But the document that's included in the, packets, that is because if we do get a reduction, we're gonna have to come up with a contingency plan. We're gonna have to look at some of the activities that you guys have planned for FY 26, which are on that second page. And we may have to look at reducing some of the funding that you all have allocated for those particular activities and initiatives. So I wanted to just give you guys that, that's gonna be included in the packets as well for tomorrow for the full council meeting. Because, like I said, if we are facing a reduction, we are gonna have to look at how we're funding things, and that may have to change. So does anybody have any questions on that particular document? The first page is our current initiatives for our action plan for this year, FY 25. And we basically put in there, how much money was allocated or budgeted for that particular initiative, how much money they spent, and then how much money they have left over. And so if we have to start reducing funding to any of y'all's initiatives, we'll make sure that we provide information on what we're recommending to the council that you guys may look at reducing and why we are, recommending those changes, or recommending those. So I'll jump right into Medicaid, because I know, the time is moving.
Cause I don't wanna do the evaluation because I have to talk.
Okay. All right, well, let me talk about Medicaid for just a second, Jill, and then we will get to that next agenda item. Does anybody have any questions about,
Yeah, no,
the restructuring or possible changes to the council's funding before I move on to Medicaid?
do we have? Do we have any comments on Zoom? Okay, Brittany, please continue.
Okay, so Medicaid, what I know, on February 25th, the House of Representatives passed a budget resolution that proposes trillions of dollars in cuts to federal spending. It asked the committee that oversees Medicaid, the Energy and Commerce Committee, to cut up to $880 billion over the next 10 years. A budget resolution was passed, and this is not a bill. So it's important for everyone to know that Medicaid is not cut yet. In Louisiana, though, it's important for everybody to know that Medicaid funding pays for programs like our waivers, the New Opportunities Waiver, the Residential Options Waiver, the Supports Waiver, the Children's Choice Waiver, our Community Choices Waiver for our adult and aging population. It pays for EPSDT, it pays for personal care services, transportation, doctor's visits, therapies, and a lot more. So sometimes people don't equate Medicaid to those services, but Medicaid pays for all of the services that I just named. And unfortunately, home and community-based services are optional. They're not, they don't have to be funded. They're optional programs. And so normally, whenever we see cuts, those optional services are the first to be cut. So this issue is directly tied to that leaked budget. And so just in case you guys haven't heard about how they're trying to restructure the Medicaid funding, they're looking at doing block grants, per capita caps. They're looking at cutting the FMAP, which is our federal match that we receive here in Louisiana. And so the block grants would basically give the states like a lump sum of Medicaid spending money. And this would completely change the way Medicaid is funded right now. And if spending exceeds that block grant amount, then the state would have to determine which services and programs to cut. Or supplement the amount of in state minimum funds. I can tell you right now, Louisiana cannot afford to do that. They cannot afford to supplement the amount that the block grant won't cover. And if we exceed spending, remember, these services are optional, so these are the services that they're gonna look at cutting first. So both block grants and per capita caps would end federal funding guarantees, and it would shift the cost to our state. Right now, our state is looking at, and I'm hoping I get this amount right. Brenton just left the table. I wanna say we're looking at $194 million deficit right now. And so I can tell you right now that our state in Louisiana cannot cover, any cuts to Medicaid. And similar to the block grants, the per capita caps, they also changed the way Medicaid will be funded. Per capita caps would limit Medicaid spending to a set amount for each enrolled. So for each person that's enrolled in Medicaid, they would get a set amount. So Angela would get $5,000, Brooke would get $5,000, Jill would get $5,000. Once they exceeded that cap, that's it. They would not have any other funding to cover any other therapies or any other doctor's visits or any other thing that you're utilizing Medicaid for. As I already said, they are looking at cutting the FMAP, which is our federal match. Right now, the FMAP is 67%. So for every 33% that Louisiana puts in, I'm trying to use round numbers. The federal government matches that at 67%. If they look at cutting that percentage, that 67%, again, the state is gonna have to look at supplementing that match. We can't. We're already looking at a deficit here in Louisiana, like I just said. So any potential reduction in Medicaid funding, and I don't understand how they can't look at Medicaid cuts with the $880 billion cut that they have to look at over the next 10 years. I don't understand how they couldn't cut Medicaid. And so, again, these are some other options too, before I go into that. Cutting enrollment services. So they're looking at work requirements. So you would be required to work. And then repealing regulations or minimum requirements, like repealing some of those eligibility requirements. So that not as many people are eligible for Medicaid. So this is what we're gonna be doing. This is what we're gonna do as a council. We're gonna be watching the president's budget until it's finalized. We're gonna watch Congress as it happens, work on appropriations while they're deciding on how these funds are gonna be spent. NACDD, our national organization, like I said, they're hosting meetings. They were hosting daily updates for every DD council across the country. They kind of scaled back because I think some of the DD councils were getting overwhelmed with some of the information. So we're gonna have policy meetings twice a month. And they're gonna make sure that they keep us updated on those rapid changes as they occur. So our priority here at the council is continuing our DD Act work and making sure that our annual action plan and our state plan is up to date. We're gonna continue planning around our next 5-year plan. So we're gonna continue to do everything that we would normally do. Our public forums that are coming up for our next 5-year plan are on May 7th. That one is in Monroe, Louisiana, and on May 14th in Baton Rouge. So I encourage all council members to please come out to those forums. I encourage you guys to invite friends and family members of individuals with disabilities. We need public input for our next 5-year plan because we need to know where the barriers and gaps are in the service delivery system so that the council as a whole can help address those in their next 5-year plan. We're gonna continue to work hard and educate our policymakers. Like I said, LACAN and our grassroots advocacy Here in Louisiana, it's second to none. I don't think any other DD council across the country, I'm bragging right now because I have encountered other DD councils. I don't think any other DD council has grassroots advocacy organization quite like LaCanton. So we're unique in that we get results. LaCanton has gotten great results over the years. Even in the 6.5 years that I've been here, they've seen great results. And so we're gonna continue to work hard as a council. We're gonna make sure that our congressional delegation is educated. At least they're gonna be educated on how these changes to Medicaid and how these changes to ACL are gonna affect people with disabilities. So that way, if they continue to vote in a way that's gonna harm our disability community, they can't say that they didn't know. They knew because we educated them. And so like I said, the councils have been asked by the NACD to submit impact statements, and rest assured that your council staff is working very hard to get those impact statements done. Our annual report for 2024, and of course, we're gonna be working on contingency plans. I wanna put this on public record, in a public meeting. This is what we cannot do. We cannot lobby. So as council members, you can't go to any of our congressional delegation or any of our state legislators, state senators or representatives and ask for the funding. As a council member, as council member Angela Harmon, you can't go in and ask for that funding. Now, as private citizen Jill Hano, you can go in and ask for funding. But you can't go in and ask for it. Oh, I am a disabilities council member. I want to ask you to help fund our DD Act programs. So I just want to make sure that we're all clear on that. We can't lobby, but we can advocate. And that's making sure that we educate our legislators on the importance of the DD councils, on the importance of the protection and advocacy agencies, and on the importance of the University Centers for Excellence.
So if I go, if I provide a public testimony, and my testimony, can I include that I'm the vice chair of the DDC?
No.
Okay.
So you are just a citizen of Louisiana in Region 10. And you are coming as a concerned citizen to ask for.
Okay.
Yes. Oh, Jill, Angela has a question.
Oh, I'm sorry, y'all.
No, the May 14th event, where is that?
The May 14th event is in Baton Rouge at the, at this library.
Oh, okay,
I
okay,
thought it was at the other
okay.
other library, the main library, but it's here.
Thank you.
It's one of these rooms.
Yeah, so yeah, please come out to our public forums. Guys, please, 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 if y'all know anyone that participated in any initiative that we've done, Partners in Policy Making, the Youth Leadership Forum, the disability voting training that we had last year, the emergency preparedness training, or even the first responder training that we had. If y'all know anyone that has participated in any of the council initiatives, I'm asking that you guys ask them to share their stories. They can either go on the LADDC news that we shared on Monday, or you can look on our social media. And I encourage all of our council members to please, if you're not following the council, make sure you are following now, because we're sharing a lot of important information. A lot of the information that we're sharing is coming from our national organization, NACDD. They pushed out a lot of information about ACL and the impact that ACL has had across the country, not just for Louisiana. But they are actively advocating on our behalf to make sure that our congressional delegation on Capitol Hill knows the importance of all these DD Act programs. So please ask your friends, anyone that you know that has participated in any council activity to share their stories with us, because we need those stories to show the impact. That is what, touches those senators and representatives' hearts when they can identify the funding with the person. That it's not just, I'm just giving this money, it's not just dollars, it's people's lives that we're talking about. So Jill, I think that was all I have. I can try to answer any questions. If I know the answers, I'll try to answer it, but if I don't, all I can say is I don't know. So if anybody has any questions about any of those federal issues, I'm willing to answer. Or at least try.
Eric,
My concern, the Medicaid part. I've been hearing that they really trying to push the Medicaid really towards the get rid of the house, taking care of somebody and really push it to the nursing homes. Is that? Did you know any more? Have you heard any more about that?
No, Eric, and I don't wanna speculate. Of course, I don't think that's anyone's intention. Well, I don't think that's anyone's intentions, but we have to educate our legislators, especially our congressional delegation, that if they cut home and community-based services, a lot of families don't have the supports that they need in order to keep their loved one at home. So in response, yeah, there could be an influx of individuals going back into institutions, including nursing homes. I don't think that's the intention, or at least I would hope that's not the intention, but I don't want to speculate. But that's pretty much the best answer I can give you. I'm sorry.
okay, so any public comment?
No, not at this time.
Okay, and I'm not checking on my committee girls, good?
Yes.
Alright, can y'all be Joe Angels?
Sure.
Alright, so how are we on time? Because I want to get to this evaluation.
Okay, we have about 30 minutes.
Okay, perfect. We had to. Okay, so the next item on our agenda is the executive director evaluation, which in our bylaws, in the first year of employment of our executive director gets quarterly evaluations, and this is her last quarterly about the COVID evaluation, so we're gonna talk about that. Alright, so how do we proceed? I don't know.
You're gonna have to do it. Someone's gonna have to make a motion.
Okay, so at this time, I need a motion from a committee member to, because of the nature of the conversation, the committee will discuss in executive session, so can I have a motion and a second to go into executive session to discuss this?
I would like to make a motion to go into executive session.
Okay, thank you, Brooke.
I second.
Thank you, Angela. So,
Hold on.
Wait, what?
Don't go into executive session yet, I have to pause everything.
Okay.